neoplasia يعني الأورام. introduction and definitions. neoplasia نسمع كلمة neoplasia نفكر أنه أقفت شيء نمو خارج الجسم، قد سواء يكون بداخل الجسم أو خارج يعني بسطح الجسم، which is abnormal. So it is an abnormality of the cellular differentiation, maturation and control of growth. Something that is out of control, يعني the body has no control on it. Neoplasm recognized by the formation of masses of abnormal tissues or tumors. And the term tumors is usually used to denote any swelling in the body, but nowadays it is most commonly used to denote suspected neoplasm. So what is neoplasm? من اسمه neoplasm معناه فد شيء جديد، وهذا الشيء growth يعني new growth which is out of the control of the human body. These neoplasms can be benign or malignant, and sometimes there's a gray area here, potentially malignant or borderline tumors. Several features they differentiate malignant tumors from benign, but the most important feature is that the malignant tumors or neoplasms tend to spread outside of the site of their origin. بينما الbenign the tumors they remain localized. What is about the term cancer? Cancer denotes malignant neoplasm. Whenever you hear cancer, this means that this is malignant neoplasm which has the ability to grow outside the origin of its site. What is the definition of neoplasm in general? Neoplasm is abnormal mass of tissue. So it is abnormal and it is a mass of tissue. The growth of this mass exceeds it is beyond the tissue. It is uncoordinated with that of the surrounding normal tissues, and it persists in the same excessive manner even after the stoppage or cessation of the stimuli that have started or evoked the change or the tumor to arise in that particular tissue. بصورة عامة أو بمفهوم عام فد شيء جاي ينمو خارج قابلية وسيطرة الجسم، وهو ليس له فائدة وليس له كنترول، الجسم ما له كنترول على هذا الجروث. The science which studies the tumors is called oncology, and the tumors they behave like organs. They have parenchyma and they have stroma, and they usually look similar to the cells of the origin of the organ of origin, and the cells continue to perform some or all of the functions of the parent organ according to the character of these tumor cells, whether benign or malignant. So what is the difference between tumors and organs? Number one, the tumors when they grow they are uncoordinated, they are aimless, they do not contribute to the homeostasis of the body، يعني ما لها علاقة بنمو أو حياة الجسم حياة الإنسان، لأنه they grow even if they cause damage or they cause harm to the body. They usually grow more rapidly than the surrounding tissues and some are benign, and some of the malignant tumors and most or all of the malignant tumors never stop growing and enlarging in their size. The biological behavior of neoplasms, what happens to neoplasms after they start to grow? They differentiate either into benign, they stay benign and they have similar features of the tissue of origin, or they become malignant in the sense that they spread to other sites in the tissue of the body. Benign neoplasms they grow slowly, they do not invade surrounding tissues or distant sites, and they rarely threaten life, and they rarely cause death or cause dangers to the life, except when they are present in dangerous sites like in the intracranial area, when they involve a nerve, or when they are present in dangerous areas like say the larynx May they cause obstruction of the breathing or may they cause massive bleeding in the body, and which is uncontrollable, and this will cause them to produce. This is mainly because of the localization or location of the benign tumors, whereas malignant tumors, they may cause death even if they are present in not in a serious or a special localization. Malignant neoplasms, they grow rapidly in comparison with the slow ones, and in comparison with normal tissue growth. They infiltrate and destroy surrounding tissues, as a matter of fact, and they cause harm to the tissues, and they even metastasize outside of their origin throughout the body, often with lethal results. They may cause death of the individual. Between the benign and malignant tumor, there's a third, smaller group of neoplasms that are locally invasive but have low metastatic potential. They are malignant, but they are locally invasive. We call them borderline neoplasms or locally aggressive neoplasms. This slide shows a comparison between the benign and malignant tumors regarding the growth features, the size, the rate of growth, the outcome, if they are fatal or not, and then the microscopic features of the benign, and the effect on the surrounding tissue, and how much they differ or are similar to the tissue of origin. This is the degree of differentiation of these tumors. In addition to the presence or absence of mitotic figures, that is how many cells are in the stage of division when we examine these slides under the microscope. How much there is the differentiation in the stroma, how much blood supply, how much connective tissue, and what is the speed of growth of tumors, especially the malignant ones. Usually malignant ones are associated with tissue necrosis because the tumor outgrows the surrounding blood supply or nutrition, so that some of the tissue becomes necrotic even while the tumor is growing, because there is no enough nutrition and the blood supply, so it is associated with necrosis. Whereas benign tumors, they do not have necrosis and hemorrhage. طيب, metastasis to distance areas is more in the malignant tumors than in the benign tumors. Let's take the main features of neoplasms in general and take them stepwise. First feature is the rate of growth. As we mentioned, that neoplasms grow more rapidly than the normal tissues, but malignant neoplasms generally grow more rapidly than even the benign ones, and there is no critical rate to distinguish the benign and from the malignant. And this, how do we know that this tumor is growing rapidly more than the other? This is assessed by the change in the size of the tumor. Some tumors, when we examine them in the first occasion or in the first visit of the patient, we take size of them, say 2 centimeters. After some time, say 2 weeks or months, we see that the size is doubled, or maybe it is in the same size, and this gives us an example about how rapid is this tumor growing. On microscopic examination, how we assess that this tumor is growing rapidly or not? This is by examining or counting the number of mitotic figures, and this means that how many cells are dividing per slide when we examine them. What is the metabolic activity of these cells, the enlargement of the nucleus, the dispersion of the chromatin, and the presence of large and multiple nuclei. This will contribute to the speed of the growth of the neoplasm. You see, when the neoplasm is rapidly growing, it needs to multiplicate. It needs to increase the size and the number of the amount of material in the nucleus first, because this will divide and make two more cells. So when these are more, it will appear in the examined slides. Number 2, the first was rate of growth. Number 2 is the size. Size of neoplasms has no bearing on its biologic behavior. يعني the neoplasm may be very large, but it is still benign, and sometimes neoplasm is very small and is very, very malignant. Many benign neoplasms are very large, and sometimes highly malignant neoplasms may be lethal because of their distant dissemination and metastasis, even though the original tumor is still small. Sometimes they cause death, even if the small tumor is still small. In a few neoplasms, such as endocrine neoplasms, the size is the deciding factor in distinguishing benign or from malignant tumors. This is sometimes, especially in the endocrine tumors. Number 3 is the degree of differentiation. What we mean by degree of differentiation: how close is the neoplasm to the tissue of origin. يعني ايش قد يشبه النسيج اللي بدأ من عنده. denotes the degree to which the neoplastic cell resembles the normal mature cells of the tissue of question, or the original tissue. This is distinct from the more general use of the word to describe the passage of a cell down a particular maturation pattern. Benign neoplasms are usually fully differentiated, يعني well differentiated. They closely resemble normal tissue. This is for the benign. This is definite. While malignant neoplasms, they show variable degrees of differentiation and frequently demonstrate very little resemblance to the normal tissue, and they are said to be poorly differentiated. This does not mean that all malignant neoplasms are poorly differentiated, but that some of them resemble the tissue of origin. We can differentiate them, and this is a tumor of the smooth muscle. This is a malignant tumor of connective tissue, of fibrous tissue, but it has features of malignant tumor. What are changes that take place in the DNA in cases of neoplasms? Neoplasms are associated with abnormalities in the DNA. These abnormalities increase with the degree of malignancy. As the malignancy increases and the tumor becomes more malignant, there are more changes in the DNA. These changes, we denote them as the degree of hyperchromatism. This is increase in the staining property of the nucleus. The nucleus, instead of become a staining purple or slightly blue in color, becomes severely blue or even black. This provides a crude assessment of the DNA content in the microscopic examinations, and the malignant cells are said to be hyperchromatic. This is in comparison with normal cells or comparison with benign cells. When measured precisely by flow cytometry, the DNA content of malignant cells correlates well with the degree of malignancy in malignant lymphoma, in urinary bladder neoplasms, and astrocytic neoplasms in the brain. Cytogenetic studies demonstrating aneuploidy and polyploidy are also indicative of malignancy. What do we mean by aneuploidy? Normally, each normal cell contains what we call a euploidy number of chromosomes. That is 2 sets of chromosomes, يعني 22 plus 1 or 23 pairs of chromosomes. This is called euploidy, يعني عدد مالتها طبيعي. but when there is more than one set of chromosomes، يعني بدل ما عندنا 46 كروموزوم يصير عندنا مثلا 72 كروموزوم، أو يصير عندنا مثلا 56 كروموزوم أو أكثر، أو عدد مو تعددي للكروموزومات بالخلية. so we call it polyploidy، أو أحيانا نسميه aneuploidy، غير طبيعي. This indicates that this tumor is malignant and the hyperchromasia is resulting from the increase in the number or in the amount of chromatin in the nucleus. Molecular techniques demonstrate clonal deletions, translocations, or abnormalities of oncogene expression are of increasing value in the diagnosis and in the study of prognosis of the malignant tumors. Okay, we're starting from this slide, the second part of this lecture about neoplasia. After discussing the previous part about the definition and a few information and features of benign and malignant tumors, we continue the other features. Now we come to infiltration and invasion. Benign neoplasms are generally non-infiltrative and are surrounded by a capsule of compressed and fibrotic normal tissue. The benign ones, that means they are not invasive, they do not penetrate or go beyond the site of the origin, whereas malignant neoplasms have infiltrating margin. Infiltrating يعني تخترق النسيج المحيط بها. Some exceptions exist. Some benign neoplasms like the granular cell tumor, dermatofibroma, carcinoma tumors, although they are said to be benign, they do not have capsule and have an infiltrative margin, but it's limited to the site of the. In tumors which are characterized by neoplasia. What is neoplasia? The neoplastic cells have no morphological resemblance to normal tissue. يعني احنا قلنا there is a percentage of resemblance، يعني تشابه بين التيومر حتى لو كان malignant والتشيو of origin. يعني إذا الأوريجين مالته مثلا adipose tissue نلقى شوية بصفات من الاديبوز tissue بالخلايا مالت المalignant tumor. But sometimes there is no resemblance، نهائيا ما إلى علاقة بصفات النسيج الليبيدي. نسمي هاي الحالة نسميها called anaplasia. The importance of these individual criteria varies with different neoplasms. The mitotic rate is the major factor to distinguish benign from malignant smooth muscle tumors or neoplasms in the uterus. But in other neoplasms, mitotic rate of little relevance. يعني مو دائما صفات ذات أهمية. This picture shows us some differences between the benign and malignant tumor. Here, there is no mass, but there are features in the tissue on the left that shows that these are healthy and there is no tumor. On the right, the tumor is present but is not producing a mass which is apparent to the naked eye. This is what we call carcinoma in situ or dysplasia. The tumor, the features of the cells here on the surface, they are malignant, but they are limited by this line which we call the basement membrane. In this second picture, which shows a glandular tissue which appears benign, but there is a mass here, something occurring which producing a tumor. This neoplasm is a benign tumor. There is no anaplasia. The cells resemble the cells of the tissue of origin. Whereas here on the right you see there is a mass, but there is much difference between the type of cells in comparison with the normal tissue of origin, and this is a malignant tumor or a cancer. This slide shows as some of the features of the malignant tumors in a gland. Here, this is the thyroid gland. This is just an example. If you want to go through it and explains you some example of how the tumor changes from normal appearance of the tissue of the cells into a benign condition and then into malignant and metastatic and anaplastic changes in the tumor of a thyroid gland. This is a picture of a tumor of the liver. You see, this is the liver, this is the whole liver, and in this area on the periphery, this area shows us a hepatoma. This is a tumor of the liver, malignant tumor of the liver. This is another section, and you see there is a difference between the color, between the structure, and all the features of normal liver are lost in this part of the tumor. As we mentioned already, aneuploidy is a feature of malignancy. In here, the DNA of the nucleus is lost. It is does not resemble the normal tissue in any way. Malignant tumors, they have these features: increased nuclear DNA, increased nuclear cytoplasmic ratio, infer the nuclear part is more than normal in comparison with the cytoplasm, hyperchromatic nucleus, coarse chromatin, wrinkled or clear nuclear edges, multinucleation, macronucleoli, numerous mitotic figures, failure of maturation, cells widely varying in size, what we call pleomorphism, loss of orientations of cells to each another. This is again abbreviation of the or a summary of the features of a malignant or cancer cell. Malignant tumors, how they metastasize. This pictures depicts the stages of metastasis. Then first, the primary tumor outside of the blood vessel or the lymphatic vessel. Then it starts to attach to the wall of the vessel, then penetrates through the wall and goes with the stream of the blood or of the lymphatics, and then goes wherever this vessel goes and becomes invasion to other sites like other organs like the lungs, the liver, or any other organ in the body. This is a uterus, female genital tract, and shows this is a tumor in the wall, which is a malignant. You see it has penetrated, infiltrated through the wall of the uterus, and whereas this benign tumor on the left, it is limited to the wall. It is not in the same patient, although it may also appear in the same patient, but it is limited. It is not penetrating through the wall. It has features similar to the surrounding tissue, but anyway, it is a tumor. It is a neoplastic tumor or a neoplasia. Down here, this is the feature of the benign tumor, and this is the microscopic feature of the malignant tumor we call leiomyoma when it is benign, and leiomyosarcoma when it is a malignant or a cancer. This shows a picture of an animation picture for the changes in the tumor. This is normal when there is hyperplasia, increase in the number of the cells, but they still resemble or similar to the cells of origin. When there is carcinoma in situ, there is increase in the number and change in the characters of the features of the tumor cells, becoming malignant, but they are lined by this basement membrane. They do not invade deeper tissue, and when they invade the deeper tissue, it becomes invasive carcinoma. And when they go to distant areas away of site of origin by the blood vessels or lymphatics, we call them metastatic tumor. This is a picture of a tumor metastasizing in the mesentery. Here seeding of tumor in the body cavities. These are the intestines, and this is the mesentery, and these small whitish areas, they represent the tumor masses infiltrating the walls of these organs in the abdominal cavity. This is how the metastatic part depicted from the previous picture appears in the lymphatic and hematogenous spread of malignant neoplasms in distant side. This is a malignant tumor, and these are the surrounding metastatic sites. This is in the lung. Histogenesis of tumor. Neoplasms are classified namely and named chiefly on the basis of their presumed cell of origin. يعني حسب نوعه النسيج اللي بدا من عند التيومر، إذا قدرنا نعرفه ننطي الاسم مالته. These cells have different potentials for further development into various cell types. This is a picture of what we call teratoma. Here you see there are different types of tissues of ectodermal origin. Here's the skin, and endodermal origin, and this is a cartilage, and these are glands as seen here. Sometimes even hair can be seen in this type of the tumor.